Welcome to another deep dive. Have you ever stopped to think about health? Not just, being not sick, but maybe as this vibrant tapestry, something woven from a community's strengths, its connections, its resources. What if we flip the script? Instead of always looking at what's missing, what if we really focused on what's strong, what's already there? Well, today we're taking a fascinating journey into a specific way of doing that. It's called health assets mapping in a community. Our main guide is a really insightful 2013 article from Gaceta, but honestly, these ideas feel more relevant now than ever. Our mission, really, is to unpack how this whole approach works. It was developed in Asturias, Spain, in a real-world setting, and it's all about helping communities find, understand, and then actually use their existing strengths to boost health and well-being. This wasn't just drummed up in a lab. It was part of a bigger regional plan for community health engagement, tied into their Health Observatory. They started by just trying to map, what activities were already happening. But the really big thing here, the compelling part, is the shift away from that traditional deficit model. The
Right.
one that just looks at problems, needs, what's wrong. This moves towards something more positive, sometimes called a salutogenic approach. So instead of only tracking problems, we're diving into the assets that actually create health. It's moving from problem solving to, well, strength building.
That's exactly it. And the source really highlights this idea of salutogenesis. It's a concept from Aaron Antonovsky. It basically pushes us to think about the factors that support health and well-being, not just the risk factors for disease.
Hmm.
It's a fundamental change in perspective, really. Understanding how people stay healthy, what helps them thrive, instead of only asking why they get sick.
That makes so much sense.
Yeah, and this flows naturally into the asset model for community development. The spotlight shifts firmly onto local strengths, not just needs. This doesn't replace the traditional view, but it complements it. It gives you a much richer health photo of a community.
A health photo, I like that.
Yeah, it combines the usual health data with this vibrant inventory of strengths, connections, resources already there. And thinking bigger picture, if we know a community's riches, its inherent assets, well, we can build much better processes for development, sustainable development.
Because you're building on what exists.
Exactly. Building on what's already there. That's just a much more powerful, more resilient foundation for any kind of lasting change.
Okay, so that's a really powerful shift in thinking. If that's the philosophy behind it, how does this methodology, you mentioned 6 phases, actually translate that into action? How does a community do this?
Right. Well, the Gaceta article lays out this pretty structured process. It's designed to take you from that philosophical idea to, concrete steps on the ground. Is definitely a journey. And it kicks off with phase 1, presentation to local agents.
Local agents, like community leaders.
Yeah, exactly. This first step is, well, it's critical. It's where you introduce the whole community participation idea alongside the health information you already have, the stats, the data from their Health Observatory, for instance, that initial health photo.
Okay.
But it's not just a data dump. It's about engaging those local leaders, the influential folks on councils and associations, getting them to see this new way of looking at things. They then connect with who the paper calls ground agents. These are the key people who will actually lead the mapping within the community.
Ah.
And what's really key here is the collective reflection that starts. It moves beyond just looking at demographics to asking things like, what actually makes this place good to live in? What groups, formal or informal, provide support? What are our green spaces, our unique talents, even our economic strengths? Things the community already possesses.
It sounds like that first meeting is less about information and more about inspiration, getting that buy-in. How important is that, especially if people are maybe used to focusing on the negatives?
Oh, absolutely critical. You nailed it. That initial chat isn't just sharing facts. It's about building the vision together. And yeah, addressing any skepticism right off the bat. Once those leaders start seeing the potential in their own assets, not just their problems, it really shores up the foundation for everything else.
Right.
Which takes us neatly into phase 2, delimitation of the mapping. This is where you get practical.
Setting boundaries.
Exactly. Defining the specific geographical area you're going to map. Thinking about the population size, what resources do we actually have, people, time, materials, and planning for what comes after the mapping. It's basically about making the project focused and manageable. You don't want to bite off more than you can chew. Try to map a whole region with just a few people, for instance.
Makes sense. Scope it properly. So once that's clear, phase 3 sounds like where the community really gets involved, working with ground agents. This involves presenting the detailed plan to them, forming a driving group, and I thought this was interesting, identifying key informants.
Mhm.
These aren't just academic experts, right? They're people with deep local knowledge.
Precisely. People who just know the community inside out or have specific insights into certain assets. And crucially, the methodology really stresses including voices from minority groups to make sure you get a truly representative picture, not just the usual suspects.
That's important.
Yeah. So this rich information, combined with that initial data from phase 1, helps you pinpoint where to actually look for assets. It's like, as you said, crowdsourcing local wisdom.
Okay, so you've got the plan, the team, the local experts.
Then comes phase 4, field work in the community. This is where, the rubber really meets the road.
Getting out there.
Getting out there. The key informants help build the actual mapping group, often with support from local groups that already do community development work.
Mm.
And the article makes a great point. Assets aren't just buildings or parks. They're found everywhere. Well, within individuals, their skills, their talents. In informal networks, neighbors helping neighbors, formal associations, clubs, groups, local organizations, cultural traditions, even economic activities.
Wow, okay. Broad definition.
Very broad. But what's profoundly important here isn't just listing things, it's the reflection that goes with it. Understanding the significance and the connections between assets.
Can you give an example?
Sure. Pick a local community garden. On the surface, it's about fresh vegetables, right?
Right.
But dig deeper, and maybe it's also a place where older residents teach younger ones gardening skills. It's a social hub for people who might be isolated. It's a green space that boosts mental well-being for everyone nearby.
Ah, I see. The ripple effects.
Exactly. Unearthing those deeper connections, those ripple effects, that's the real goal the article talks about.
And how do they actually find these assets? The article mentions some really creative participatory techniques, not just surveys.
Yeah, they really emphasize community-driven methods beyond the usual interviews and focus groups, which are useful.
They mention a mapping party. That sounds fun.
Doesn't it? It's basically where people get together and literally map out places, resources, connections on a big map of their area. Anyone can join in. It's super inclusive.
That's cool.
Yeah, a great way to spot everything from favorite parks to vital social hubs. Then there's systematic observation, just paying close attention to everyday life, conversations, interactions, to spot those informal assets that might otherwise be missed.
And what about those other tools? I was really struck by the focus on creative, empowering methods, like photo voice.
Oh, photo voice is powerful. You give people cameras, or these days they use their phones, and ask them to capture images that represent their community, its strengths, its challenges.
And then they discuss the photos.
Exactly. The discussion around the photos is where the magic happens. It reveals so much about hidden strengths, different perspectives, people's stories.
And I love the idea of narrative research or storytelling, getting people to share how they've overcome difficulties.
Those stories themselves become assets, right? They build resilience, inspire others, foster connection.
Absolutely. And coffee talks, that just sounds so welcoming.
It does. Just small, informal chats, maybe 5 or 6 people around a table. A facilitator keeps notes, summarizes themes as people mingle and rotate between tables.
Low pressure, high interaction.
Totally. A fantastic way to get people talking, uncover shared ideas, build trust. The point is, these aren't just cold data collection tools. They're community-building activities in themselves. They create ownership, excitement.
That makes a huge difference, I bet, ensuring it's a grassroots effort, not just some top-down study.
Precisely. So once you've identified and explored all these assets using these rich methods, phase 5 is about visibility through Web 2.0.
Okay, Web 2.0. They're articles from 2013, so that means...
Yeah, think early social networks, interactive online directories. Today, we probably talk about, dynamic community websites, maybe special apps, online knowledge hubs.
Got it. But the core idea is the same.
The core idea is timeless. Make these discovered assets visible and accessible online. The example they used was their Asturias Actua site, a place where assets could be tagged, maybe seniors for things relevant to older adults, or youth for programs for young people. Community activities get logged, too. It creates this digital repository.
So it's not just a static list, but an active resource people can search and use.
Exactly. A living directory of community strengths.
That digital hub sounds brilliant for access, but you do all this amazing work mapping strengths, creating this rich health photo. What if people can't or don't use the website? How do you make sure everyone knows?
Great point. And that leads directly into the final phase, phase 6, transfer to local agents and the population. Because you're right, web tools are great, but digital access isn't universal. The article is really wise about this.
So how do they bridge that gap?
Through broad, inclusive sharing. Think dedicated feedback sessions, big community meetings, public forums where people can discuss the findings, even using traditional methods like printing summaries in municipal newsletters or local papers.
Covering all the bases.
Exactly. The goal is to make sure the whole community really sees and understands this new asset-rich health photo, the full picture, challenges, and strengths.
Because that shared understanding is what sparks change.
Precisely. It ensures all that valuable knowledge doesn't just stay online or in a report, but actually empowers action, right down to the grassroots level.
This whole process, from engaging leaders to sharing widely, feels really integrated.
It is. It makes sure that mapping assets isn't just a one-off task. It becomes a dynamic part of how the community develops over time. Like the 4 says, it transforms mapping from just collecting data into this active journey. Citizens discover positive things, build support networks, and then, crucially, launch projects that actually improve quality of life and health.
It creates a living network of strengths.
That's a great way to put it, not just a static inventory.
And it's impressive just how broad their definition of an asset is. The paper mentions it's useful for social participation, action research, and lists examples. It really covers everything, doesn't it? Individual talent, someone's great at organizing, maybe someone else is a skilled craftsperson.
Mm-hmm. Formal groups, like sports clubs or faith communities,
Mm-hmm.
but also those less visible things.
Like neighbors checking in on each other, informal care networks.
Yes, and physical things too. Parks, libraries, community centers, even economic assets. Local businesses doing well, cultural assets, theater groups, music traditions.
And they even include formal institutions like council services or local clinics.
Absolutely. It's a truly holistic view. The idea is not to overlook any potential strength that helps the community thrive. It gives you that full inventory.
It really does shift the narrative. Instead of feeling defined by lacks, communities get empowered by what they have.
It's powerful. But, like any big community project, there are practical challenges.
Oh, yeah. Like what?
Well, keeping people engaged consistently through all 6 phases can be tough.
Yeah.
Communities have other priorities, maybe histories of distrust that make participation hard.
Maintaining momentum.
Right. And building and sustaining those new networks takes ongoing effort. Doesn't just happen automatically after the mapping.
And measuring success.
That's another challenge. How do you really measure the long-term impact? How do you quantify things like increased social connection or community pride? It's not always easy.
Those are really important points. The methodology gives you the structure, but success really depends on that sustained, dedicated effort from the community itself. So we've taken quite a deep dive here into health assets mapping. It's this methodology that really empowers communities, helping them look past the problems and see the wealth of resources they already hold. And it's not just data collection, is it? It's this dynamic 6-phase journey. Citizens finding positive factors, building support, launching projects, ultimately improving quality of life and health. It's really a journey of discovery and connection. You can just imagine the shift, going from feeling maybe overwhelmed by problems to feeling genuinely empowered by knowing your collective strengths.
Absolutely. And stepping back for a moment, if this approach is so useful for community participation and research, it kind of makes you wonder, doesn't it? How might this way of thinking influence how we think about well-being? Maybe on a more individual level or even within our own smaller circles, families, workplaces.
That's an interesting thought.
What health assets, maybe personal skills you have, support of friends or family, a park you can walk in, cultural traditions you value, what assets are already present in your immediate environment right now, just waiting to be, mapped and celebrated? How might just shifting your own perspective, adopting that asset-based lens, change how you approach your own goals or challenges. Maybe seeing problems less as roadblocks and more as opportunities to use the strengths you already have.